Hello, I am Katie Johns here at Renew Integrated Medical Spa, and I am here with my favorite person, Teresa Fontenot. And Teresa, I just wanted to kind of let everybody know what we're doing here at Renew Integrated Medical Spa with functional medicine. And I know that your background is in family practice, so what made you kind of decide to go into functional medicine? And tell us a little bit about that.
Well, after 18 years in primary care and doing family practice, I noticed that some of my patients just didn't seem to be getting better, or that I found that I just couldn't really improve all their symptoms.
Mm-hmm.
So, and I knew I needed to probably find a different approach rather than just pharmaceuticals or drugs alone. So I went ahead and I pursued getting a board certification in anti-aging medicine, and also I'm pursuing the same thing with functional medicine with the Institute of Functional Medicine. And the difference really is, I think that functional medicine is definitely a new practice in medicine. And what it is it's looking more at root cause of disease versus just really looking at symptoms. So in treating a diagnosis, rather than just looking at high blood pressure and giving a high blood pressure medicine, I would look at what's causing the high blood pressure.
I love that. So let's say I came in and I had a diagnosis of fibromyalgia.
Mm-hmm.
How would you treat that versus maybe the traditional medical approach?
Well, glad you asked that, Katie,
Yeah.
because that's actually one of my favorite diagnoses now. I used to really dread it in primary care because we really didn't know what to do about fibromyalgia. So now I really like to see fibromyalgia patients because really what we need to do is treat their inflammation. So in treating their inflammation, it really improves all of their symptoms. So I look at them more from what is causing that inflammation. We change their diet, and we change exercise level, even their thought process, because they have chronic pain. So
Yeah.
once we kind of are able to really work with our lifestyle educator and change a lot of their lifestyle aspects, I've seen people, I think that we pride ourselves here at the clinic that if a fibromyalgia patient walks through the door, I can see a difference in their pain level within 30 days.
That's amazing. That is awesome. And it gives hope to so many people.
It gives hope.
Yeah,
Mm-hmm.
Absolutely. Tell me a little bit about the labs that you perform here.
We do some advanced marker labs,
Mm-hmm.
and it's one of the reasons why a lot of people like to come in to see us. It gives what I call a 30,000-foot view of kind of your health.
Mm-hmm.
Rather than just looking at traditional labs, I look at advanced cardiac markers, and I also look at such things as inflammatory markers, certain genetic markers.
Oh, yeah.
And this allows us to look at a person more from what we call a bio-individual aspect. Bio-individuality is really looking at what makes that person unique.
Yes.
Because there's nobody where you can just look at their chemistries, look at their sodium, potassium, what their white blood count
Right.
is, and be able to determine that. This determines what makes that person function different. Their inflammation, their genetics, and then some advanced cardiac markers, and also some markers that are pre-diagnostic markers that tell us kind of like, is diabetes coming, or
Right.
do we have really early indicators of maybe a heart-related issue?
Yeah, I think that's so important, and I think so many of us are different, and so if we do just go and maybe get treated for, say, a symptom, it's not going to be as thorough, and I love that we can get now advanced knowledge of what might be coming and start being proactive with our health versus reactive, and I love that we do that.
Really treating the person as a whole person.
Mm-hmm.
More
Absolutely.
than just seeing a symptom, it's really looking at their whole belief system too.
Absolutely. So what areas of lifestyle does your program address? I know we talked about that a little bit, but maybe in depth kind of what someone can expect when they come into lifestyle coaching.
Lifestyle coaching is kind of arguably one of the most important aspects
Yeah.
of a wellness program. And what it is we have a lifestyle educator that deals with nutrition,
Mm-hmm.
and deals with stress factors and how to address that stress and improve it, thought patterns, exercise, and sleep, and the importance of relaxation. And once we look into all these aspects and can change them in a person, it's amazing what happens to their laboratory.
Absolutely. Well, there you have it, everybody. Now you know a little bit more about our wellness program here, and most importantly, functional medicine. We want to take a proactive approach to health. Thank you so much for being here with us today and
Thanks,
telling us
Katie.
more about it.
Yeah.